Okay, so we have an unfolding case study for liver failure from things other than hepatitis. So on day one, we have Mr. Harris Drinkerton. He's a 46-year-old male who was brought to the emergency department after his wife, Mrs. Drinkerton, found him in the backyard confused and surrounded by several beer cans. The client has several labs done, which came back with a blood alcohol level of 20 milligrams per deciliter, AST ratio of 3:1, and an ammonia level of 80. The assessment findings include lethargy, jaundice, skin and sclera ascites, guarding tenderness of the upper right quadrant of the abdomen, and muscle weakness. His vitals are blood pressure 118/67, heart rate 140, O2 98%, temperature is 99.2, and his respiratory rate is 18. The wife also mentions to the nurse that Mr. Harris has more than 15 drinks in a week and has ever since their son passed away several years ago. The nurse reports this to the provider, and the provider orders a liver biopsy, paracentesis, and hepatic angiography to assess for liver damage. Okay, so complete the following sentence by choosing from the list of options. The nurse should anticipate an increase, decrease, no change of sodium, potassium, AST/ALT for a patient with cirrhosis, kidney stones, or a UTI. So the answer here is going to be an increase in the AST/ALT for a patient with cirrhosis is going to be indicated because it will indicate that the liver is inflamed, which is the case with cirrhosis patients. Okay, so the next question says, based on Mr. Drinkerton's report, what assessment findings could indicate that Mr. Drinkerton has alcohol-based cirrhosis? So here, the AST/ALT again is going to be indicated. The temperature is going to be not indicated. Drinking history will be indicated, and jaundice will also be indicated. And the rationale for that is that the AST/ALT ratios are going to be elevated, jaundice will be present due to the liver failure, and the drinking history is going to be a primary finding that lets us know that it is alcoholic cirrhosis. As the nurse prepares Mr. Drinkerton for his paracentesis, what nursing interventions are most important? Select all that apply. So we have A, instruct clients to empty their bladder. B, administer medication for conscious sedation. C, apply a sphygmometer to monitor blood pressure. D, ensure client has signed a consent. E, position the client in an upright position. F, assess Braden scale. G, have client practice deep breathing and cough. H, administer opioid pain medication. So the answers here are going to be A, C, D, and E. The rationale is that the patient should be instructed to void to reduce the risk of an accidental bladder rupture. An upright position is used for paracentesis, and the client's blood pressure should be monitored during this procedure. Alright, so now we move on to day 2. The next day, Mr. Drinkerton is more alert, but still having some confusion. The provider orders lactulose and rifaximin to decrease ammonia levels and increase mental alertness. The results for the hepatic angiography indicated that Mr. Drinkerton has liver varices, and the liver biopsy confirmed cirrhosis of the liver. The paracentesis was able to remove 2 liters of fluid, and the provider orders spironolactone 75 milligrams PO daily, thiamine 25 milligrams PO daily, folic acid 1 milligram PO daily, albumin 75 grams IV daily via saline lock, and cholestyramine 4 grams PO Q12 His current vital signs are blood pressure 142/84, heart rate is 85, O2 saturation is 99% or room air, the temperature is 98.5, and his respirations are 16. So our first question for day 2 is, the nurse is doing hourly rounding on the client when the client expresses that he feels like the hospital staff is judging him and that he doesn't even drink that much. He says he doesn't believe that his cirrhosis is caused by his drinking and that the staff is just making it up. What is the best therapeutic response to a client's statement? A, why do you feel like you aren't drinking that much? B, you have every right to be upset? C, nobody here is judging you, or D, tell me more about your feelings of being judged. So the answer here is going to be D, and D is the most therapeutic response, and you never want to ask why questions when dealing with therapeutic communication. Alright, so our next question is, complete the following sentence by choosing from the list of options. The nurse will have to monitor for signs of hyperkalemia, hypokalemia, or drowsiness because of taking thiamine, spironolactone, or lactulose, which is potassium, magnesium, or sodium sparing. So the answer here is going to be hyperkalemia, spironolactone, and potassium, and the rationale is because spironolactone is a potassium-sparing diuretic, which has the adverse effect of leading to hyperkalemia. So based on the provider's orders, what adverse effect of the medication should the nurse watch out for? Select all that apply. So we have A, hyperkalemia, B, restlessness, C, cyanosis, D, constipation, and E, muscle cramps, F, mania, G, restless leg syndrome, H, jaundice. So the answer here is going to be hyperkalemia, restlessness, constipation, and muscle cramps. And the rationale is that these are all associated with spironolactone, allergic reactions, and adverse reactions to thiamine. So we have day 3. The nurse goes to get a morning assessment on Mr. Drinkerton due to the lab calling with an abnormal potassium lab value of 6.2. Upon assessment, the nurse notices that he is having heart palpitations, shortness of breath, chest pain, and nausea. The nurse takes vitals and they are as follows. Blood pressure 100/54, heart rate is 54, O2 is 95%, respirations are 26, and the temperature is 99. The nurse quickly provides 2 liters of supplemental oxygen. The provider orders a 50 milliliter of 50% D50 IV bolus with 10 units of insulin. Mr. Drinkerton's symptoms begin to resolve, and he is now closely being monitored for the next few hours. The provider decides to change his spironolactone to furosemide 20 milligrams as he notices Mr. Drinkerton is retaining too much potassium. So which of the following is not a symptom of hyperkalemia? So you have positive Chopstick sign, B, decreased blood pressure, C, muscle cramps, D, weak and slow heart rate. So your answer here is going to be A, and the rationale behind that is because this sign is associated with hypocalcemia. All the other ones are associated with hyperkalemia. Mr. Drinkerton had hyperkalemia as an adverse effect of his diuretic. What foods could he have avoided in order to keep his potassium down? Select all that apply. A, avocado, B, salt substitutes, C, bananas, D, apples, E, potatoes, F, blueberries, G, apricots, H, cherries. And the answer to this is going to be A, B, C, E, and G. And the rationale is that all of these foods have more than 200 milligrams of potassium per serving. So, based on Mr. Drinkerton's primary diagnosis, what interventions would be indicated? For each potential intervention, Click to specify whether the intervention is indicated, not indicated, or contraindicated in the plan of care. So your intervention neuroassessments Q4 is going to be indicated. Record abdominal girth daily is also going to be indicated. Administer acetaminophen 650 milligrams PRN for temperature greater than 101 is going to be contraindicated. Low sodium diet is going to be indicated. Daily weights is indicated, and renal dialysis is not indicated. So the answer here, or the rationale, is going to be that these interventions focus on treating and monitoring ammonia levels in ascites. Renal dialysis is not necessary, and acetaminophen is contraindicated due to the ascites. So day 4, we have discharge. Days pass and Mr. Drinkerton is doing much better. His potassium level has remained at 4.2, ammonia level of 35, and a serum blood glucose of 86. On an assessment, his skin color is appropriate for ethnicity, white sclera, alert and oriented ×4, abdomen is non-tender, and he has a +2 muscle strength. The provider decides that Mr. Drinkerton is cleared for discharge and will be sending him home with metformin 500 milligrams PO bid, Lasix 40 milligrams PO bid, and a potassium dietary supplement. The nurse gets his discharge vital, and they are as follows. Blood pressure is 136/82, heart rate's 82, O2 99% on room air, respirations are 14, and the temperature is 98.4. So as the hyperkalemia is resolved, the nurse documents and reviews the vital signs, ammonia, and update potassium level. Complete the following sentence by choosing from the list of options. The nurse determines the client's status is improving, deteriorating, or unchanged, as evidenced by vitals, patient wanting to leave, or the medications, and the nurse should now request order for more lactulose, apply restraints, or explore readiness to stop drinking. So the answer here is going to be improving vitals and explore readiness to stop drinking. And the rationale is that the client's condition is improving based on stable vitals and lab values, and the nurse should now explore readiness to stop drinking as the patient prepares for discharge, as drinking cessation is important to bettering the patient's condition long term. As Mr. Drinkerton is preparing for discharge, what discharge education would be indicated or not indicated relating to his diagnosis? So all of these are going to be indicated, and that is because the first dose, as well as signs and symptoms of adverse effects of medications, are important because the client wants to understand the use of the medications and what to watch out for. Drinking cessation is important to not progress the cirrhosis further, and self-care is also going to be important for his psychosocial integrity, as that is what led him to over drinking to begin with. So you were teaching Mr. Drinkerton about signs and symptoms consistent with ascites versus elevated ammonia. For each finding, check the finding that is most consistent with either condition. So the answer and rationale here is that abdominal girth, bulging flanks, peripheral edema, serum albumin are all associated with ascites as fluid is retained, and dozing off and on and agitation is associated with elevated ammonia due to the toxicity. And here we have the 5 references.